He was 65 years old, retired postal worker, a quiet man. He sat on the edge of my exam table looking uncomfortable. Not in pain, just unsure. "Doc," he said, "I don't know what's going on down there." I asked what he meant. He lowered his voice and replied, "It feels dry, kind of raw. And honestly, I've lost some sensation. It just doesn't feel the same." So I asked him a simple question. "How do you wash down there?" He looked confused. "Same as always. Antibacterial soap. Scrub it good. Then I hit it with a little body spray, just to stay fresh." I looked at him and said, "You think that's clean. But your body's telling a different story. And that's the truth most men never hear. After 60, your skin changes. Your nerves change. Your recovery slows down. But your habits? They usually stay the same, even if they're hurting you." This video is for men like him. And maybe for men like you. We're going to talk about how to wash and care for your penis the right way after 60. Leave your question in the comments. Like and share this video if it truly helps you understand your body better. Let's get into it. Mistake number 1. Overwashing and harsh products. When I asked how long he'd been washing that way, he said, "Since I was a teenager. No one ever told me otherwise." And that's the root of the problem. Most men were never taught how to clean their genitals properly, so they just guessed. Scrub harder. Use strong soap. Add powder or spray to smell fresh. It sounds logical, but it's completely wrong. The skin on your penis, especially the head, is not like the skin on your arms or chest. It's thinner, more absorbent, more sensitive, and it has its own natural defenses. A moisture barrier, good bacteria, balanced pH. When you scrub too hard or use harsh products, you destroy all of that. Antibacterial soaps are the worst offenders. They strip away everything, not just dirt, but the good stuff your skin needs to stay healthy. Fragrances and alcohols? They burn, they irritate, and they leave micro tears that can become entry points for bacteria. Body sprays, powders, and colognes? They might smell good, but they do more harm than good. One of my patients, 63 years old, used cologne on his inner thighs for years. He thought it made him more attractive. Then one day the skin blistered. Chemical burn. It took 3 weeks to heal. He couldn't walk without pain. And his confidence dropped through the floor. All from something he thought was just good hygiene. Here's the truth. Your penis is not a dirty car. You don't need to scrub it to keep it healthy. You need to respect its balance. Overwashing doesn't just cause irritation. It can lead to loss of sensitivity, recurring fungal infections, delayed healing, even performance issues over time. Because when your skin is inflamed, blood flow decreases. And when blood flow suffers, so does function. And here's the kicker. Most men don't realize it. They think it's just getting older. But in reality, it's self-inflicted damage. This sounds familiar? Don't panic. You can undo a lot of the damage. Start by stopping. Ditch the antibacterial soap. Throw out the scented body wash. Avoid anything with alcohol, menthol, or artificial fragrance. For the next few days, use warm water only. Let your skin rest. Then, maybe 2 or 3 times a week, use a gentle pH-balanced cleanser with no scent. Pat dry with a clean, soft towel. Don't rub. Don't reuse yesterday's towel. Wear loose, breathable underwear. Cotton only. No tight briefs. No synthetic fabrics. Give it 1 week. That's all. 1 week of gentler care. You might be shocked by what happens. One man told me, "Doc, I didn't know I could feel this comfortable again. I thought that part of me was just done." It wasn't. It was just mistreated. When you stop hurting your skin starts healing. And better skin leads to better sensation, better comfort, and better performance. So yes, overwashing is a big mistake. But it's one that's easy to fix. Now that you know what not to do, what's the right way to clean it? Let's talk about that next. the right way to clean it. So we've covered what not to do. Let's talk about what to do instead. Because the truth is, cleaning your penis the right way isn't complicated. But it does require intention and respect. The goal isn't to scrub it until it feels raw. The goal is to support your skin's natural defense, so it can protect you. Here's exactly how I teach my patients to wash step by step. Start with warm water. Not hot. Not cold. Warm. Hot water strips away your skin's natural oils. Cold water shocks the tissue and leaves residue behind. Warm water loosens debris without harming the protective layer. Once the water is running, use your hand, just your hand, no washcloths, no loofahs. If you're circumcised, gently lather a small amount of pH-balanced, unscented cleanser in your hands. Apply it lightly to the shaft and head. Don't scrub. Don't use your fingernails. Let the soap do the work, your job is just to guide it. Rinse thoroughly with warm water. Make sure no soap is left behind. Even gentle cleansers can irritate if not washed off fully. Now, if you're not circumcised, pay attention here. Gently pull back the foreskin. Use only water under the foreskin, no soap. Soap can get trapped inside, which may lead to irritation, inflammation, or infection. A gentle rinse is more than enough. Then roll the foreskin back over the head. Comfortably, not forcefully. Once rinsing is done, turn off the water and take a moment. Don't rush to grab a towel. Let the air touch the area for 10 to 15 seconds. Then dry. And here's where many men make a crucial mistake. They rub the area dry like they're drying their back. No. Use a soft, clean towel, one that's reserved only for your groin. Pat gently. Don't press hard. Don't rub side to side. Think about how you dry a baby's skin. That's the kind of touch you need. Now let's talk about what not to apply after washing. No talcum powder. No body spray. No cologne. No essential oils. I know. Some products say fresh or masculine scent. But the skin in that area wasn't designed to be perfumed. It was designed to breathe, to feel, to respond. And you can't do any of that when it's inflamed. One patient of mine, a 67-year-old gentleman, used essential oils for men that he bought online. After just 3 uses, he developed peeling skin and redness that wouldn't go away. It took 2 rounds of treatment to calm the reaction. He told me, "I thought I was being natural and smart. Turns out I was just being sold to." Marketing preys on insecurity. But your penis doesn't need marketing. It needs care. Clean doesn't mean smelling like a flower. It means protecting your future function. Now, how often should you wash with cleanser? Not daily. That surprises a lot of men. Unless you've been sweating heavily or had intimacy, you only need gentle cleanser 2 to 3 times a week. On the other days, just rinse with warm water. That's enough to stay clean without stripping the skin. Here's a quick summary. Use warm water. Use a pH-balanced, unscented cleanser 2 to 3 times per week. Use water only under the foreskin. Pat dry with a soft towel. No fragrance, powder, or refreshing sprays. Might feel like you're doing less, but in reality you're doing it right. Because the goal isn't just to look clean. It's to stay healthy, comfortable, connected to your body. And when you follow these simple steps, you may notice something else too. Less irritation, less dryness, more sensation. That's not coincidence. That's biology healing. And remember, you're not trying to undo 40 years of damage overnight. But starting today, you're giving your body a chance to recover. And that's powerful. So now you know how to wash. But what comes after washing is just as important. How you dry, what you wear, how you support the area daily. Let's talk about that next. Post-wash care, drying, clothing, and daily support. You've just finished washing the right way. No scrubbing. No harsh soap. No cologne. Good. But now comes a part that most men ignore. Post-wash care. Because how you treat that area after the shower can make or break everything you just did. Let's start with drying. This is where most men go back to old habits. They grab a towel, rub like crazy, move fast, get dressed immediately. Don't do that. Your skin is still soft and open after a warm shower. It needs gentle handling. Use a clean, soft towel. Not the one you used on your feet or face. Not the one that's been hanging in the bathroom for a week. You need a dedicated towel just for your groin. And you pat. You don't rub. Light taps. Especially under the scrotum, between the thighs, and around the base. Anywhere moisture hides. That's where fungus and irritation start. Let the area breathe for a moment before dressing. Stand or sit in a clean space for 30 to 60 seconds. Let air finish what the towel started. Next, underwear. What you put on after washing matters just as much as how you wash. And this is where old habits really need to die. Tight briefs? Synthetic fabrics? Elastic bands that dig into your hips? All of these reduce circulation, trap heat, encourage sweat, and over time, they numb you. Literally. One patient of mine wore compression-style underwear every day, from morning till night. He said it held everything in place. But he also had tingling in his testicles, low drive, and discomfort when sitting too long. We changed one thing. Switched him to loose, 100% cotton boxers. 2 weeks later, he said, "Doc, I didn't know things could feel normal again." That's not magic. That's oxygen. That's space. Here's what I recommend. 100% cotton underwear. Loose fit. No compression unless prescribed for medical reasons. Change it daily, no exceptions. Even if it looks clean. Even if you didn't sweat. Change. Every day. And when you wash your underwear, do it right. Use unscented detergent. No fabric softeners. No dryer sheets. Those leave chemical residues. And they can irritate your skin for hours, especially when mixed with sweat. Also, wash your underwear separately if you can. Don't toss it in with gym towels and socks. Keep it clean. Keep it simple. Now let's talk about something most men never consider. Nighttime. Do you wear underwear to bed? So, it might be time to rethink that. Sleeping in underwear traps heat, prevents airflow, and keeps moisture locked in. At night, your body is trying to repair itself. Restore circulation. Let things settle. Give it that chance. Wear loose pajama pants. Or sleep without underwear altogether, if that's comfortable for you. Many men feel weird at first. I get it. But once they try it for a few nights, they report better sleep, fewer itches, and even morning erections returning. What? Because oxygen is medicine. And no part of your body needs oxygen more than the one you keep wrapped up and ignored. What you wear after washing matters just as much as how you wash. So here's the checklist. Pat dry with a clean, soft towel. Let the area air out for 30 to 60 seconds. Wear cotton, loose-fitting underwear. Wash it properly. Avoid chemicals, scents, and tightness. Let your body breathe at night. These aren't fancy tricks. They're foundational habits. And when done consistently, they help prevent irritation, restore sensation, and protect your function long-term. You don't need expensive sprays or high-tech underwear. You just need to give your body what it's asking for. Clean space, gentle touch, and breathable fabric. Now let's say you've done all of this, but something still looks or feels off. How do you know when it's time to see a doctor? What warning signs should you never ignore? That's what we'll talk about next. Red flags, what to watch for after washing. So you've done everything right. You've cleaned gently, dried carefully, worn the right underwear, but something still feels off. Maybe it's a patch of dry skin that won't go away. Maybe it's a strange color. Maybe it just doesn't look normal. This is where too many men make a dangerous mistake. They stay silent. They wait it out. They tell themselves, it's probably nothing. But in my experience, probably nothing has turned into absolutely something more times than I can count. So let me walk you through the red flags. The signs that your penis might need medical attention. The first one is redness that won't go away. If you notice a red patch, and it sticks around for more than 2 weeks, don't ignore it, especially if it's getting darker, growing in size, or feels warm to the touch. Second, flaking or peeling skin. Occasional dryness is normal, especially in winter or dry climates. But if your skin keeps peeling, or forms rough patches that don't respond to moisturizer, something deeper may be going on. Third, sores or ulcers. Any open area on the penis, especially one that doesn't hurt, is a serious red flag. Yes, you read that right. Penile cancer doesn't hurt. That's why it's dangerous. It doesn't throb. It doesn't sting. It just sits there, quiet but growing. And by the time most men notice it, it's already advanced. Fourth, unusual discharge or foul odor. If you notice anything sticky, white, yellow, or smelly, that's not normal. It could be a sign of infection, or an imbalance in the skin's bacteria, or something more serious. Fifth, tightening of the foreskin. If you're uncircumcised, and the foreskin starts to feel tight, like it won't pull back easily, that's not just aging. It could be a condition called phimosis, or even the start of lichen sclerosis, both of which can lead to pain, scarring, and long-term dysfunction if ignored. And finally, lumps or bumps under the skin, especially if they're hard, don't move when pressed, or grow over time. Now, not every change means cancer. Not every bump is dangerous. But the point isn't to scare you. It's to prepare you. And the best way to prepare is to observe. Here's how. Take a photo. Yes, use your phone. Keep it private. But document what you see. Then check again in 7 days. Did it change? Did it spread? Did it fade? If it's still there after 2 weeks, go see a urologist. Don't Google it. Don't ask a forum. And please don't just hope for the best. Because in this area of your body, early is everything. I once had a patient who waited 6 months to ask about a flaky spot. By then it had doubled in size. And what could have been treated easily turned into months of treatment and surgery. If he had come in sooner, he could have avoided all of it. So let's be clear. Redness that lasts more than 2 weeks. Flaking or peeling skin. Sores or ulcers. Discharge or foul odor. Tight foreskin. Lumps or swelling. These are your warning lights. Don't ignore them. If you've noticed anything unusual, and you're not sure what to do, leave a comment below. I'll do my best to guide you. And if it seems serious, I'll tell you straight. Because silence doesn't protect your health. Action does. Now here's a question most men never ask. Even when they notice these signs. Why did I stay silent for so long? Why didn't I speak up earlier? Let's talk about that next. Psychology and shame. Why men get it wrong. Why do men wait? Why do they stay silent? Even when something feels off. It's not because they don't care. It's not because they're lazy. It's because of something deeper. Shame. Confusion. Old habits. Most men over 60 grew up in a time when you didn't talk about your body, especially not that part of it. You kept quiet. You figured it out alone. Or you ignored it. And if something felt wrong, you pushed it aside. Because talking about your penis, even with a doctor, felt like weakness. I've had grown men, strong men, veterans, fathers, look me in the eye and say, "Doc, I'm embarrassed even bringing this up." And I always tell them, I'm not here to judge your past. I'm here to help you move forward. Because here's the truth. Many men have been hurting themselves for decades. Without even knowing it. They were taught that cleaning means scrubbing. That being a man means staying tough. That asking questions makes you soft. But that's not manhood. That's misunderstanding. And it shows up in so many ways. Men scrubbing too hard. Because they think pressure equals hygiene. Men spraying cologne on their thighs. Because they think smell equals confidence. Men wearing the same tight underwear they've worn since their 30s, because no one told them to change. Men who feel something's wrong, but never speak up. I had one patient, 71 years old, who told me he hadn't felt anything down there in over 2 years. Not pain, not pleasure, just numbness. He assumed it was part of getting old, that his body was done. But it wasn't. It was just neglected. And when we talked more, he admitted something that broke my heart. I never really thought about caring for it. It never felt like something I should protect. That mindset is more common than you think. So let me say this clearly. Caring for your penis is not about ego. It's about respect. Respect for your health. Respect for your body. Respect for the life you still have to live. Because your penis is not just an organ. It's a symbol of connection. To yourself. To your partner. To your sense of identity as a man. And when you stop caring for it, you don't just lose function. You lose part of how you feel like yourself. But here's the good news. It's never too late to change that. I've seen men in their 60s, 70s, even 80s, reclaim comfort, sensation, and confidence. Not through surgery, not through pills, but through awareness, through care, through gentle daily respect. And it starts with letting go of shame. There is nothing weak about asking for help. There is nothing foolish about learning something new. There is nothing unmanly about protecting your health. In fact, that's what real strength looks like. So if you've been doing it wrong for years, you're not alone. And you're not broken. You were simply never shown a better way. But now you know more. You've seen the harm. You've seen the healing. And you get to choose what happens next. Let today be the turning point. Not a punishment for the past, but a commitment to the future. And it starts with one small question. What if I treated this part of me with the same care I give to my eyes, or my heart, or my breath? Not because I'm afraid of disease, but because I deserve to feel whole. That shift, from fear to respect, is where healing begins. Now, speaking of healing, what happens when you stop using this part of your body altogether? What happens when it goes dormant? Not just physically, but emotionally? That's what we'll explore next. And it might surprise you. Not moving the pelvic area / letting it go dormant. He was 70, retired, healthy by most standards, no diabetes, no heart disease. He walked a little, ate fairly well. But he looked down at the floor when he spoke to me. Doc, I haven't felt anything down there in a long time. It's like it's asleep. Like I forgot what it means to be a man. That statement stayed with me. Because he wasn't talking about just sex. He was talking about connection. About feeling alive. About ownership over a part of himself that now felt distant. And when we dug into it, the answer was simple. He had stopped moving. Not completely, but enough to matter. He used to hike. Now he stayed in. He used to stretch every morning. Now he skipped it. He used to engage, physically, intimately, emotionally. Now he sat, waited, faded. Here's what most men don't know. Your penis isn't just a tube for urine or pleasure. It's part of a complex muscular, vascular, and neurological system. And it relies on movement. Let's talk about the pelvic floor. This is the group of muscles that sits like a hammock beneath your pelvis. It supports your bladder, your bowels, and yes, your sexual function. When these muscles are strong and active, blood flow improves, control improves, sensitivity improves. But when they weaken, everything suffers. You get weaker erections, less sensation, dribbling after urination, difficulty holding gas or urine, a general feeling of disconnection from your manhood. And the worst part? It happens slowly, silently, over years. So most men don't notice. They just assume it's age. But it's not just age. It's dormancy. It's what happens when you stop using a system that was designed to be used daily. And the good news? You can wake it back up. The tool is simple. It's free. It takes 2 minutes a day. Kegel exercises. Yes, they're often associated with women, but I teach them to every man over 60. Because they work. Here's how to do them. While sitting or lying down, tighten the muscles you'd use to stop urinating midstream. That's your pelvic floor. Hold the squeeze for 3 to 5 seconds. Then relax for the same amount of time. Do 10 to 15 repetitions, 2 to 3 times a day. Don't hold your breath. Don't squeeze your thighs or butt. Just focus on the internal lift. It may feel subtle at first, like nothing's happening. But in 2 weeks, you may notice better bladder control, improved erection strength, increased sensation during intimacy, even less lower back discomfort, because your pelvic floor connects everything. It's not just physical, it's emotional. When a man reclaims control over this part of his body, he often reclaims confidence, presence, posture. One patient told me, "I didn't just feel stronger. I felt like myself again." Now, Kegels are just the beginning. You can also walk 15 to 30 minutes daily. Do gentle pelvic tilts while lying down. Practice deep belly breathing. Try light planks to engage your core. All of these restore circulation, support your spine, and activate the muscles that support erections. Think of it this way. If you don't move your legs for a week, they get stiff, weak, disconnected. Your pelvic area is no different. It needs motion, blood, attention. And the more you use it, gently, respectfully, the more it remembers how to work. Because that's the truth most men never hear. If you stop using it, you don't just lose it, you forget it's even there. And that forgetting, that numbness, it doesn't just affect your body. It affects how you carry yourself. You walk with less pride. You sit with less awareness. You show up differently. With your partner. With yourself. In the mirror. But when you begin to move again, when you reconnect with this center of your body, you get more than sensation. You get presence and peace. Not because you're chasing youth, but because you're honoring function. And honoring function leads to freedom. You don't need to run marathons. You just need to remember that this part of you is still alive. Is still yours. It still matters. So start with Kegels. Start with walking. Start with one deep breath each morning, through your belly, into your center. Because motion brings memory. And memory brings manhood back. Now maybe you're wondering, if movement is so powerful, why do so many men skip it, and instead reach for pills, powders, and manhood boosters? Let's talk about that next, and what those shortcuts might really be costing you. Final message, start small, stay consistent. If you've made it this far, I want to say something very simple. Thank you. Because watching a video like this means you care. And caring is the first step toward change. You didn't come here looking for a magic pill. You came here looking for understanding. And that tells me something powerful about you. You're ready. Ready to stop treating your body like a machine. Ready to stop ignoring the signs. Ready to stop feeling ashamed for needing guidance. And most of all, ready to come back to yourself. Not with drastic changes. Not with empty promises. But with daily, honest care. You've learned how to wash your penis gently. How to dry it. How to support it with the right clothing. How to spot danger signs early. How to move again. How to feel again. And I hope you also heard something deeper. That your manhood is still yours. That age doesn't erase it. That stillness doesn't kill it. That shame doesn't define it. Function fades when we stop paying attention. But it returns. When we do. Not overnight. Not perfectly. But steadily. One warm rinse. One soft towel. One walk around the block. One Kegel at a time. You don't need to become someone else. You just need to come back to the part of you that's always been waiting, quietly, for you to notice. That's not weakness. That's strength. That's wisdom. Elderly wisdom. And it's yours to live by. If anything in this video spoke to you, I'd love to hear about it. Leave a comment. Share a thought. Ask a question. You never know. Your question might be the reason another man finally gets the answer. He's been too afraid to ask. And if this video helped you, please like and share it with someone else who might need it. You don't have to fix everything today, but you can start. And starting small, with consistency, is how real healing begins. Take care of yourself, because you're worth it, and I'll see you in the next video.